fall semester. And joining us live to talk more about that is Keith Grant. He is the Senior Director of Infection Prevention with Hartford Healthcare. Keith, welcome back.
Thank you. Thank you for having me.
So tell us about Hartford Healthcare's Campus Health. What is it and how is it helping to return students back to colleges?
Good question. So Campus Health is a group that includes the entire Hartford Healthcare body that consults and work with campuses in different healthcare settings and scenarios. And obviously, getting students back is a big concern. And the Hartford Healthcare community has been very involved with that through Campus Health.
All right. What kinds of things can students do to stay safe on campus?
So, I spoke about this a few times this morning, and this is a message that should go out to everyone. So, in Connecticut, we've done this before. So, and what I would say we've done very well is proper social distancing, proper use of universal mask wearing, proper hand hygiene and other infection prevention practices. Staying home if necessary. If you feel like you have some symptoms, report it as soon as possible. For students, I would say report it to your student health body as soon as possible. And communicate. If you see something that seems unsafe for yourself or the rest of the student body, say something as soon as possible.
All right. What about in the dorms, common areas, and classrooms of colleges? What are your recommendations for that?
Acknowledging that it's going to be very challenging. So I can say social distancing, absolutely, in those areas. But we know, or I remember being in the dorms in college, and it was very difficult to administer any degree of social distancing. So with that being said, ensuring that you're universally masked as much as possible. If you can social distance, maintain that. Anyone within that dormitory that has any form of symptoms or any level of symptomology, that should be reported as soon as possible. And it should be reported to the student health body and communicated promptly so we can get proper help. We could administer isolation if necessary and quarantining as much as possible if necessary. Great advice.
All right, why do schools quarantine students when they first come to campus?
That is a very, very good question. So imagine multiple people coming from multiple areas, multiple students coming from multiple areas across the country with different level of prevalence. Now, when the students come back, what they come back with, the time period that it would need for us to notice, we're estimating between 7 to 14 days. So if that initial quarantine is done, coupled with testing, then we're able to say this is what we have. So you're clean slate per se. And after that 14 days, good monitoring system in place, and you're able to maintain and create your own pseudo environment, so to speak.
Okay. Keith Grant, thank you once again for stopping by and sharing your time with us. We always appreciate it. Thank you.
Absolutely.